Let's keep this discussion going with Dr. Bayo Curry-Winchell, Family Medicine and Urgent Care Medical Director, joining us from the Regional Clinical Director of Carbon Health and St. Mary's Medical. That's a mouthful. Forgive me. I'm trying to get a lot out there. Where are you, if I may ask? What state are you in?
Well, thank you for having me. I'm in Nevada.
Oh, great. It is great to have you. Thank you. So we've got the news now. The FDA, the CDC saying get the booster is essentially the message. If you are 18 or older and you're fully vaccinated at 6 months, get shot number 3.
It is. This is wonderful news. We know the data shows that over time, especially after 6 months, that there is a weakening or a decrease in strength of immunity. And so having a booster really provides a longer lasting level of protection.
So what are you hearing from your patients or from your colleagues about the questions people have about getting the booster?
The main question is, do I really need a booster and why? And so my answer is absolutely. We know in the past, with certain vaccinations that we've had to have boosters in order to continue a level of protection. And so this is the same thing. We need to continue to really be able to at least control. We will unlikely eradicate this virus, but we have to find measures to control it, and a booster provides that opportunity.
Have you gotten your booster?
I have, as well as my children received their first dose.
Congratulations. I know that's a sigh of relief for so many people. If you got the J&J vaccine, I have a friend, I've talked about her a couple of times. She's in San Francisco. They were allowing people before all of this, if you got J&J, to mix and match and go get one of the mRNAs. What are you seeing in Nevada? Is that happening? And would you advise people who got J&J to maybe go get one of the other vaccines?
I would. We now know that really having a mix of your vaccine offering provides a higher level of protection, especially when you talk about the J&J. So anyone who has, received that vaccine and 2 months out, please go ahead and get your booster. And I do recommend, utilizing either Moderna or Pfizer, because that is going to provide a higher level of protection.
In your part of the world, in Nevada, especially with the holidays coming up, so many people want to travel. They want to get away and have some fun. And we think of Nevada as one of the places to do that. Do you have any concern about those of us who are vaccinated or people who are vaccinated doing those kinds of things?
Well, I think it's important, as we move forward, we have been in this pandemic for 2 years. And so I think we have to really think about the importance of enjoying, the holidays and really having a return to our lives. But we can do that, but we just have to think about what ways that can really help us remain protected. And how do we do that? Number one, please go forward and get vaccinated if you haven't. Number two, if you are attending an event and you're unsure of those, vaccination status, think about wearing a mask. And number three, hand washing, social distancing. I always like to remind people hand washing was important before the pandemic. So all of those measures mentioned will help you return and, go travel, visit your families. It's important that we find a way to return to our normal lives.
We appreciate your joining us and want to wish you a happy, safe, and healthy Thanksgiving. Congratulations again on the kids getting their shots. Dr. Bayo Curry-Winchell is a family medicine and urgent care medical director joining us from Nevada.